Hello everyone, my name is Víctor Hernandez Mondragón and I work in the Department of Digestive Endoscopy of the Specialties Hospital at the National Medical Center in Mexico City. I want to present you the paper entitled Feasibility of the peroral endoscopic myotomy poem procedure with a new small caliber endoscope, Thieme poem, in patients with achalasia. As you know, besides achalasia is a low prevalent disease that has a worldwide distribution, its treatment has had a big change with the advent of poem procedure. The results at early, mid, and long-term evaluations in different endoscopic centers around the world are similar to those observed with laparoscopic hilar myotomy, and is considered the gold standard nowadays. However, sometimes there are challenging poem procedures, mostly in long-lasting achalasia patients or those with megaesophagus, making poem a more difficult procedure. So, we hypothesized and based in the concept of a less invasive procedure that a small caliber endoscope could overcome these drawbacks and that could be as efficient and safe to perform poem procedure as with a normal caliber endoscope, even in challenging procedures with the potential advantage of being a small-sized endoscope potentially generating a less aggressive procedure compared with a normal-sized endoscope. This is why we present you this work in which we evaluated the feasibility of using a small caliber endoscope to perform poem procedure in patients with achalasia that we named Thieme poem. In brief, we used a 5.8 mm nasoendoscope which has a 2.4 mm of working channel, which has the advantage of allowing the introduction of different normal endoscope accessories such as clips and the hybrid knife. In this study, we included 45 patients, and they had similar safety and efficacy as in the conventional poem, with the advantage that Thieme poem has quicker procedural times compared with conventional poem, and that we could introduce a new closure method that is based on the use of cyanoacrylate glue. We confirmed that this closure method is safe, effective, quick, and cheap, so we concluded that it's an excellent closure alternative in poem procedures. Finally, this work is interesting because the median follow-up was of 12 months, and this could allow us to evaluate better all procedural outcomes, such as the incidence of reflux disease and all adverse events. And we observed that the obtained data is similar to that of conventional poem procedure. Our next step will be to compare directly both procedures in a clinical trial in order to confirm which ones are the real advantages of this procedure compared with the conventional poem. So our final conclusion is that Thieme poem is an excellent alternative to perform poem procedures, even in challenging cases, and cyanoacrylate use is an excellent alternative that can be used to close the entry site in all cases. Finally, the use of small caliber endoscopes in the gastroenterology field open a window in order to perform these invasive procedures not only in adults, but also in pediatric population with excellent safety and efficacy. Thank you very much.